to see both new and familiar faces in the audience, including some mentors, colleagues, and friends in the quality assurance NHP space, and I'm grateful for you all being here today. In today's session, we are going to review why the new version of the GMPs matters, extended responsibilities for importers, quality management system essentials, demonstrating foreign GMP equivalence, warehousing, distribution, and 3PL requirements, validation, stability, and retention samples, documentation and data integrity, CAPA, deviation, and continuous improvement. Then we're going to provide a quick readiness checklist and some next steps. So why does this update matter? As Carolina mentioned in the intro, this is the first full rewrite of the GMPs in more than 10 years. And this version does far more than update terminology. It introduces a meaningful shift in how Health Canada expects companies involved with natural health products to operate. The revised guide strengthens the framework for accountability by addressing long-standing gaps and providing more explicit expectations for quality oversight throughout the entire supply chain. The update places greater responsibility on the facilities that manufacture, import, package, label, and distribute natural health products destined for the Canadian market. Under version 4, these facilities must demonstrate an enhanced level of control, documentation, and ongoing oversight to ensure that products consistently meet regulatory and quality standards. With the transition period ending in early March of 2026, a few weeks from now, this is a critical time for companies to assess their existing systems, review their quality and supplier arrangements, update their procedures and documentation. Organizations must ensure that every aspect of their operations align with the strengthened expectations in version 4 to maintain compliance and support uninterrupted market access. The new GMP expectations. Health Canada is shifting away from the historical reliance on procedural checklists and moving towards full accountability for the effectiveness of a company's quality system. Rather than focusing solely on whether individual tasks were completed, version 4 evaluates how quality decisions are made, how risks are identified and controlled, and how consistency is maintained throughout the supply chain. This approach requires facilities to demonstrate that they understand the risks associated with their products and processes, have controls in place to manage those risks, and continuously monitor the performance of those controls. This extends beyond domestic operations. Health Canada requires importers to oversee the quality practices of foreign manufacturers, labelers and packagers, and any contracted partners involved in the handling of natural health products. This updated regulatory philosophy aligns more closely with established pharmaceutical principles. As a result, expectations for oversight, documentation, verification, and scientific justification are significantly higher than in previous versions of this GMP guide. This shift underscores Health Canada's intention to strengthen product quality and increase confidence in the safety and consistency of natural health products available to Canadians. What this means for importers. For importers, these updates represent one of the biggest shifts in responsibilities. Under previous GMP version, importers could rely on supplier attestations or generic statements of compliance. Version 4 eliminates this approach. Importers are now expected to verify GMP compliance through documented evidence, ongoing monitoring, and active quality oversight. If a foreign partner fails to meet expectations, Health Canada treats it as a compliance failure of the Canadian importer, not the foreign site, placing the onus on the Canadian site license holder. Quality Management System QMS requirements. Every organization that holds a site license must operate under a fully documented QMS, which is the framework that ensures products are consistently safe, controlled, and compliant with regulations. A robust QMS brings together all quality-related activities and includes a quality manual that explains how the system works, clearly defines roles and responsibilities so everyone understands their part, and controlled procedures that outlines how tasks must be performed to maintain consistency. It also requires active management oversight, meaning leadership must regularly review system performance, monitor quality indicators, and address issues before they impact product safety or compliance. QMS requirements. Version 4 strengthens expectations for how senior management participates in the quality system. In previous versions, management involvement was encouraged but not always clearly defined. Under the updated guidance, leadership must be actively engaged, not just approving documents. Senior management is responsible for providing the resources needed for quality operations, such as trained staff, appropriate facilities, and suitable equipment. They must participate in reviewing quality issues, approving key decisions, and ensuring that the organization continuously evaluates and improves its processes. Under the new requirements, the QMS is no longer something that only the quality department manages. It is a system that must reach every part of the organization, from suppliers and warehousing to packaging, labeling, distribution, and final release. Version 4 also formalizes the expectation that quality is everyone's responsibility and that the organization must be able to show through clear documentation and management engagement how it consistently delivers products that meet Health Canada's standards. Risk management tools such as HACCP, hazard analysis and critical control points, FEMA, failure modes and effects analysis, or other structured QRMs, or quality risk management methods, must be integrated into the GMP process for identifying and controlling product risks. These tools help organizations understand where failures may occur, how severe the impact could be, and what controls are required to prevent them. Health Canada emphasizes continuous improvement, which means these risk management practices must be applied consistently and updated as operations, partners, or product risks evolve. Demonstrating foreign GMP equivalence. Perhaps the most consequential update relates to verifying GMP equivalence at foreign sites. Importers must now maintain detailed, current evidence packages for each foreign manufacturer, packager, or labeler. Approved evidence includes recent audits, inspection certificates from credible regulatory authorities, signed quality agreements, monitoring records, and supplier requalification activities. Perhaps the most important update is how importers must now verify that foreign sites meet Canadian GMP standards. In practical terms, this means importers can no longer rely on a simple statement or certificate from a foreign site. Instead, they must keep a complete and up-to-date evidence package for every foreign manufacturer, packager, and labeler involved with their products. This evidence can include recent audit reports, inspection certificates from trusted regulators, signed quality agreements that outline responsibilities, records showing how the site is monitored over time, and documents proving the site has been requalified when needed. While tools like the Foreign Site Reference Number help with submissions to Health Canada, they do not replace the importer's responsibility to actively oversee their partners. Health Canada expects importers to treat foreign sites as if they were a part of their own internal quality system and to be fully accountable for how those sites operate. I'm going to repeat that because that is probably the most important message you will hear today. Health Canada expects importers to treat foreign sites as if they were part of their own internal quality system and to be fully accountable for how those sites operate. Health Canada expects importers to treat foreign sites as extensions of their own quality systems, adopting compliance oversight for all involved parties. Warehousing, distribution, and 3PLs. This is also a very interesting update. Under the previous GMP version, expectations for warehouses, distributors, fulfillment centers, and logistic partners were more vague. The groups were generally expected to follow good practices, but they were not formally treated as part of the regulated GMP supply chain. Many importers relied on informal agreements or basic operational standards without structured oversight. Version 4 changes all of this. Warehouses, distributors, e-commerce fulfillment operations, and 3PLs, third-party logistic providers, which are companies that store, handle, and ship products on behalf of the importer, are now clearly defined as GMP-controlled environments. Because of this, importers must verify that these partners maintain proper temperature and humidity control, sanitation, pest management, and qualified equipment. Under version 4, importers must have written quality agreements, scheduled audits, and documented monitoring to show that these partners comply with GMP expectations. Most importantly, if a warehouse or logistics provider mishandles product, Health Canada considers it a compliance issue for the importer, even if the importer does not own or operate the facility. Validation requirements. Version 4 introduces stronger and more detailed expectations for both manufacturing and analytical validation. Health Canada now wants importers to confirm that key steps in manufacturing and packaging have been tested and proven to work consistently, not just once, but every time a product is made. This includes steps that affect product identity, purity, potency, and overall quality. Importers must be able to show that foreign sites have validated their processes, meaning the site has collected evidence demonstrating that the process is controlled, repeatable, and capable of producing the same results batch after batch. This level of validation reduces the risk of variability or unexpected quality issues. Health Canada also expects analytical methods used for testing ingredients and finished product to follow established scientific standards, such as ICH, which is the International Council for Harmonization Guidance, or recognized pharmacopoeias. These standards help ensure that test methods are accurate, sensitive, and reliable. Stability and retention samples. Version 4 introduces much stronger expectations for stability programs than earlier versions of the GMP guidance. Real-time stability studies are now clearly required to verify shelf life, meaning expiry dates must be supported by data collected under the actual storage conditions listed on the label for the full shelf life of the product. Accelerated stability testing can still be used to help set an initial expiry date, but it cannot replace real-time studies. Lots used in real-time stability must be representative of the commercial product with the same formulation, container closure system, and manufacturing process as the lots sold in Canada. Retention sample expectations are also more clearly defined. Importers must keep enough fully packaged retail units from each lot to allow complete finished product testing in duplicate if Health Canada requests verification. Retention samples must reflect the product exactly as sold, including the final container and label, and must be stored under the same conditions listed on the label in a temperature and humidity monitored area. Samples for each lot must be retained for at least 1 year after the product's expiry date, and retention samples must be managed under written procedures with traceable records that show where they are stored and how they can be accessed for testing. Retention samples are distinct from stability samples, and both sets must be maintained separately. Documentation and data integrity. Health Canada places significant emphasis on record quality and data integrity in version 4. All GMP records must follow good documentation practices so they are complete, traceable, and reliable throughout their entire life cycle. While the guide doesn't use the ALCOA acronym directly, the expectations fully align with its principles. ALCOA stands for attributable, legible, contemporaneous, original, and accurate. This means records must clearly identify who performed an action and when it occurred, attributable, be legible and permanent, legible, be documented at the time the activity takes place, contemporaneous, be retained in their original form or as a verified true copy, original, and reflect the actual results or event without errors or unexplained changes for accuracy. Together, these principles ensure that information used for quality decisions is trustworthy and defensible. Documentation from foreign partners must be available in one of our 2 official languages, English or French, and translations must be completed by a certified translator or supported by a sworn affidavit to ensure accuracy. The untranslated originals must be kept on file and provided to Health Canada upon request, of course. Electronic systems used for GMP data must be validated to demonstrate reliability and suitability. They are required to have audit trails that track changes, controlled user access so that only authorized individuals can enter or modify information, regular backups, and proper security measures. Records must be stored under conditions that prevent loss or deterioration and must be retrievable on request, including in printed form. For importers, this means being able to provide complete, accurate, and readily accessible records from both Canadian and foreign sites during inspections with minimal delay. Health Canada's emphasis on documentation, quality, and data integrity is far more explicit and structured than in previous GMP versions, reinforcing the importance of strong record governance across the entire supply chain. CAPA and continuous improvements. Version 4 of the GMPs provides clear expectations for corrective and preventative actions, otherwise known as CAPAs, and deviation management. The guidance requires importers to maintain documented procedures that outline how deviations are identified, how root causes are investigated using structured tools, how corrective and preventative actions are implemented, and how their effectiveness is verified over time. This ensures that quality issues are not only addressed, but also prevented from reoccurring. Health Canada also expects importers to use trended analysis supported by a CAPA log or tracking system to identify patterns and reoccurring issues early. Regular internal self-inspections are required to evaluate the performance of the CAPA system, confirming ongoing compliance and assess whether corrective actions have achieved their intended impact. Senior management must remain actively involved in CAPA oversight. Leadership is expected to review CAPA findings, allocate resources, prioritize improvements, and ensure the quality system continues to strengthen over time. Version 4 reinforces that quality governance must be visible at the executive level and not limited to the quality department. To be fully prepared for the March 2026 enforcement date of the new GMPs, organizations should complete several actions, and this is our readiness checklist to share with you. Begin with a comprehensive gap assessment comparing current practices to the expectations outlined in version 4. This includes evaluating quality systems, supplier oversight, documentation controls, stability programs, and record governance. Standard operating procedures, or SOPs, must be updated across quality operations and supply chain functions, particularly those dealing with CAPAs, data integrity, supplier qualification, deviation management, and recall processes. Strengthening supplier qualification packages and updating quality agreements is essential to ensure responsibilities, audit rights, and oversight expectations are clearly defined. Organizations should confirm that their stability and retention sample programs meet the updated requirements and validate any electronic systems used to create, store, or manage GMP data. Robust documentation control and appropriate audit trails must be in place. Training must be provided to staff at all levels to ensure they understand their responsibilities under version 4. Internal audits and mock recalls should also be performed to test system readiness, identify gaps, and ensure inspection preparedness before enforcement begins.
Thank you so much, Annie. That was very informative. I was going to say it's a mouthful to talk about GMPs for such a long time. So thank you so much for walking us through it. So I'm going to move on to the next slides and just outline how SNI supports compliance. But in the meantime, if anybody has any specific questions, please feel free to please put them in the chat. Once I'm done, we can go through those and Annie and myself can answer those questions. Or if you have any additional questions, please feel free to email our general info@sourcenutra.com email, or you can also email myself and Annie as well. So key areas of support that SNI provides include complete QMS development and modernization for both importers and site license holders, meaning anybody who essentially manufactures, packages, or labels products in Canada, including storage. The SNI regulatory team can also support with SOP creation that aligns with the new GMP update. We can also support with supplier qualification and audits, including foreign partner evidence. So essentially, this is a gap assessment of what the foreign partners are doing, where they need to be, and what actions need to be taken for them to get into compliance. Something that's super important, as Annie mentioned, is going to be an area of I don't want to say problems. We don't want any problems in those areas, but area that Health Canada will be focusing on moving forward and requiring that, those agreements are airtight and that Canadian entities have oversight over what is happening on foreign soil and have some sort of action plan of how they're going to be managing that and verifying that quality, in alignment with the GMP requirements and the new update. We can also do gap assessments with tailored remediation plans on our end, stability and retention program review, either it be testing of the products in Canada to determine the product stability, or accelerated product stability and other testing in accordance with the Natural Health Product Regulations. And last but not least, of the best things that our team supports with is the pre-inspection preparations for the version 4.0 requirements. So, reviewing any of the evidence that you might have, the processes, sanitation programs, documentation processes, etc., and just making sure that everything is all good to go, whether it be for a site license renewal or an inspection. Our team is here to support and would be happy to provide additional guidance. So I think we're all good to take a few questions if anybody had any. So I don't see any in the chat. I'll give a few minutes. Yes, thank you. I see that Annie also put our email address in the chat for you as well, for you to reach out. So if you have any questions, please do so, and we'll be happy to support. Other than that, I will stop the recording.